Good afternoon. My name is Tawana Berry, and using our inclusive introductions, I am an African American woman. My hair is in braids and a bun on top of my head. I am wearing, that's a pinstripe linen suit today, and I am fairly tall, so those are fairly tall. There are some others in here that are taller than me, but I am fairly tall. Looking at you, Melissa. I'm an associate director at WestStat and a member of the Society's advisory board. WestStat is a research and health communications consulting firm headquartered in Rockville, Maryland, and we work mainly with government programs. So our health communications practice, which is growing, is made up of over 40 communications professionals with expertise in strategy, social media, partnerships, content development, media relations, you name it. WestStat and Society are very pleased to convene this panel today. We're going to continue our discussions on misinformation and how it relates to the work we do as health communications professionals. As the COVID-19 pandemic made abundantly clear, misinformation can have serious public health consequences. So this panel will explore why people believe misinformation, who is most susceptible. We always tumble over that word, right? Every single call we've had, I've stumbled over that word. Susceptible to misinformation, where it circulates, and then most importantly, what we can do as health communicators to kind of mitigate and tackle misinformation. So I'm pleased today to be joined by my panelists. I'll let each of them introduce themselves to you by telling you a bit about themselves, their work, and especially the work that they're doing as it relates to tackling health misinformation. So I'll begin with Lisa on my right.
Yeah. Hey, everyone. I'm Lisa Fazio. I'm an associate professor of psychology at Vanderbilt University. I've been studying misinformation since 2010, so long in the game here. I do a lot of work on the effects of repetition on belief and how that's used by bad actors, but also how the good guys, like you guys, can also use repetition for good. I also do a lot of work on interventions and what can we do to prevent belief in misinformation and to correct false beliefs once they have occurred. Pronouns are she, hers. I'm sitting here in a wrap dress, white woman, short hair. I am short. I'm on my little tippy toes here to sit comfortably in the chair. Yeah.
Hello. Okay. Hi, everyone. My name is Jessica Otero Machuca. I'm with Mayo Clinic as part of the Florida Community Engagement Alliance against COVID-19 disparities. I am a Latina woman with curly hair, also short, wearing a black t-shirt and a blazer. And my work with misinformation has been working really closely with communities, specifically in Florida, to address the different things that they might be hearing surrounding COVID-19 and figuring out ways to strengthen trusted channels of communication and ways to maybe distract from those that aren't as trustworthy or might be spreading misinformation.
Good afternoon, everybody. I'm Matt Kruder. I'm an old white guy, I guess, would be my key identity characteristics. And when I'm, while I'm being an old white guy, I am a professor of public health at Washington University in St. Louis. I also direct the Health Communication Research Laboratory there. Our center works closely with community partners to increase the reach and effectiveness of health information for low-income and minority populations, and also using information technology to help increase people's access to connect them to needed services. And our involvement in misinformation is much more recent than yours, Lisa. When the COVID-19 vaccines arrived in St. Louis, within a week, we got a call from the director of public health at St. Louis County explaining how her staff were being inundated by misinformation, and they were pretty sure that what they were hearing wasn't true, but they weren't 100% sure, and they definitely weren't prepared in the moment to address the information they were hearing in concise and accurate ways. And so that conversation started, launched what was the first is the first local misinformation surveillance and response system in the U.S. in St. Louis. It's called iHeard, and I'll be sharing some of our experiences with iHeard on this panel today. Thanks, Tawana.
And you all are in for a really good treat. All of these panelists, like you heard, are working in the realm of misinformation and have very great experiences to share. So I'll begin by just throwing out some questions, and they're, for the good of the group, and anyone can take them. But I would love for you guys to also weave in some of those experiences that you've had, those real-world experiences, in what you're doing and the work that you're working on right now. So let's begin really, what are the immediate and long-term consequences of misinformation on public health? And from your experience, how do those challenges manifest in different communities or populations?
I can go ahead. So our experience as part of SEAL in misinformation was in Florida throughout the whole pandemic. We just saw a lot of misinformation being spread, and we saw it in different buckets. So there was like the people who were hearing misinformation from political leaders who were saying things that weren't completely accurate about COVID-19 prevention. And then they were hearing things about the vaccines that weren't completely true, but they were believing it and acting on it and then spreading it. Then we had the people who were hearing misinformation that was more rooted in fear. So we saw a lot of deaths and like, oh, the vaccine is just a way to make you think you're protected, but it's not protected. Or, oh, you're an immigrant and you don't have documentation. Going to get vaccinated means you're going to get deported. And so while those are really completely things, one on like the health information front and the other just on general, I guess, policies, they both negatively impact community members in not wanting to seek out vaccines or maybe not protect themselves from COVID-19 in the ways that they should have, the ways that were evidence-based. And so Brian Southwell over at RTI, we wrote a paper together on health misinformation and maybe the relationship that it has with health disparities. And that's something that we saw a lot in the COVID-19 pandemic, was that misinformation impacts decision making. And when you have communities that are more susceptible already to disproportionate burdens of disease, but are plagued by misinformation everywhere, that's going to impact their decision making into maybe not making the healthiest choices for them in their community. And so I can talk a little bit more later about how we address that, but that's definitely the biggest way that we saw it go into effect. And it definitely came through just people going to specific messengers that were more prone to spread misinformation because of a lot of things. And we've talked about intersectionality in the last panels, which I love, but it really was just an intersection of different determinants. So like not having access to healthcare, and because of that, hearing misinformation, thinking, oh, this is a person I trust, like surely they're right, or not knowing where to seek out health information. But again, I heard it from this person, so that has to be what is true. So definitely a lot of things that contributed to spreading misinformation, and thankfully we worked with really great community partners to address that. But it was really challenging at first, just seeing how much misinformation was out there and all the negative ways that it was impacting our community.
Yeah, and building on that, I think one of the important things to think about is why are people believing this misinformation and why are they seeking it out? And one of the things we saw during the pandemic was people didn't know what was going on. It was an uncertain disease, especially early on. It was uncertain what you should be doing. And in those situations, people want certainty. And it happens to be the case that providing false information is way easier to be certain. It's way easier to provide a clear-cut story of what's going on. And it's way easier to make these kind of easily digestible, believable nuggets of information, even if they're false. So I think one of the big challenges for the people in this room is how can we make the true information equally as digestible and informative, and also make sure that it's answering the questions that people actually have. And I think that's one of the things that's so great about this I Heard is figuring out what do people want to know about and how can we make sure that they're getting that information they want from someone that they trust and is accurate.
I would just add one thing to the consequences of misinformation, and that is that it put a fair number of public health workers and other workers in the health sector at at risk, at personal risk. They were threatened, they were harassed in ways that affected them personally and their families, and also their ability to carry out their work. And that's a non-trivial consequence, I think.
And it seems like we are more susceptible, that word, to misinformation lately. Why is that? Does it just seem as if it's around more, or what shifts have occurred? And Lisa, you've been studying this since 2010. Maybe you kind of know the longitudinal what's happening over time and why we're more susceptible to misinformation.
Yeah, I think there's a few things. One is misinformation is a very old problem. Ancient histories had problems with misinformation and false narratives. There's nothing new about our brains and how they work. I think what's new is that we have new communication channels. There's been this diversification of where people get their information from, which has some wonderful benefits, that people can listen to more diverse voices, but it also means that there's a lot more people speaking without appropriate expertise, or people who are purposefully lying to gain attention or money or status or any combination of those. And so misinformation can spread way more easily now than it could in the past. If you think about the guy in the public square yelling and handing out pamphlets, like, he has always existed in American history, but now he has a web page and a Twitter feed and hundreds of thousands of followers. And so his message is getting out to a lot more people. So I think that's a big thing. And I think we also see these increases in both the proliferation and the belief in misinformation when there's a crisis, when people are uncertain, when there's a lot of open questions. And as a society, we've been having a lot of that over the past few years.
I would just add to that, Lisa, that I think, as you alluded to before, there's certain context that makes misinformation more likely to succeed. And some of those are when public understanding is low or public uncertainty is high. And one of the things that's different about this moment in time is that it's much easier in an information age to find out what people know, believe, think, and what they don't know, believe, and think. And when you find areas that, where the public has very low understanding, it's really easy to nudge people in one direction or the other. And I think that's part of the context where misinformation thrives.
And Jessica and Matt, in your work within the community, are you seeing who's likely to spread misinformation? Are you seeing that there are different, either it's communities or different types of personas that are likely to be like the arbitrators of spreading this misinformation? Are you seeing a lot of that more in certain communities?
I can start us off. To be honest, I think that a lot of communities that we work with are just relational people. And so, granted, it might start from a political source who is trying to give out the narrative that maybe COVID vaccines aren't effective or wearing masks isn't good. But then because we're relational people, I'm like, hey, did you hear that this might be bad? Do you think that's true? Whether or not the person thinks it's true, maybe they're going and being like, hey, to their other friend, did you hear this was true? What do you think? And so that is what was unique about the COVID-19 pandemic, kind of like what you were saying, is people wanted certainty. People wanted to know what the answers were. People wanted to know what to do. And everyone had an opinion, but unfortunately they weren't stopping to think what the consequences of their opinion might be. And so I wouldn't say that we could point to, there were definitely community leaders who said a lot, and that information definitely spread quicker than maybe just like an individual person in the community, but there was not one person or one unique characteristic to those spreading misinformation, just because it spread so fast in the relational sense.
Here's the way our iHeard system works. So every Saturday afternoon, we send a 2 to 3 minute mobile phone survey to 200 community members in St. Louis. And we ask them basically 3 questions. We're asking about health information they've heard in the last 7 days. And we want to know what they've heard, we want to know where they heard it, and we want to know whether they believed it. And and we know whether the information is accurate, inaccurate, or uncertain. When people hear inaccurate information, they're more likely to cite social contacts and social media as the source of that. When they hear accurate information, they're more likely to cite news media sources. So that's part, I think, of an answer to your question. And and that also gives us hints, I think, about what the appropriate responses might be for that. And so what in our system, within 48 hours of that survey going out, we can identify what we think is the biggest information threat in St. Louis that week. And we do 3 things with that information. First of all, we put it on a public-facing website with the accurate responses to what people are hearing. Secondly, we produce an alert that focuses on the top issue that week, and we send it to 100 community organizations in St. Louis so that we get more of a coordinated response community-wide. So everybody is sort of focused on the same thing at the same time. And then third, we create digital assets, and we share them with trusted local messengers who can distribute those through their social media network. So that's sort of the approach that we're taking.
And so I know that, Lisa, you've done some research on once misinformation is corrected and clarified, that some people have trouble reasoning around getting to the right information. So can you talk a little bit about the barriers to debunking misinformation once it has spread? Sounds like, Matt, you have a great resource that is, getting that corrected information out there, but there still will be barriers for folks, right, to believe that information once it's out there, once they've already believed the misinformation. So I think your research has touched a little bit about that and kind of how people have to, the trajectory that people have to go to kind of change their mindset a bit.
Yeah, so I want to talk about a few things. One is that misinformation debunks work. They're incredibly effective. They are not perfect. People forget them just like they forget all sorts of information. But on the whole, they're useful. There have been concerns in the past about backfire effects, where if you try and correct people, maybe they'll double down and believe the false information more. Those effects haven't replicated in the field. It seems like for most people, if they read misinformation, if they read a misinformation debunk, something correcting a false belief, they either just ignore it or it helps increase the accuracy of their beliefs. But like you mentioned, it doesn't get them back to ground zero. It doesn't get them back to where they were before they believed the misinformation. So the best thing we can do is prevent people from hearing it in the first place, or give them the tools so that when they do hear it, they know to pause and think and kind of ignore that piece of information. So there's something we call either inoculation or pre-bunking, which is basically warning people about the types of things they're likely to see and why it might be wrong. So before an election, I can warn all of you that you will see a viral rumor about there being ballots by a river. Uncounted ballots by a river. Every time we have an election, there is a viral rumor about ballots found by a river that are not being counted. And you can talk about how in the past 20 years, that's never actually been the case. And then if people do see that message pop up on social media, they can be like, oh, right, that's that thing. It's probably fake. I'll look into it, or something like that. So I think the best thing we can do is both try and correct the things that we know are out there, especially when you've got this great listening panel and you know exactly what's out there. Creating a good debunk to that can be incredibly effective. It's not as good as if they had never been exposed, but it's way better than leaving them as they are. And the second one is figuring out what's going to come up. So the COVID vaccines were a great opportunity that I think we didn't do a good job with, where we know what types of anti-vaccine misinformation is out there. There's a long history of disinformation about vaccines. As a country, we could have been and should have been prepared that these types of rumors and misinformation were going to appear, and could have prepared our communities for what they were going to come up against in the next few months. And unfortunately, that didn't happen, and now we're trying to make up that ground.
Matt, did you want to comment on that?
Sure. It may be useful to also think about our response to misinformation as kind of what's the acute response, what's the immediate response, and what are some longer-term strategic responses that we can be doing. And so I think like in the short term, like the immediate response, the fact-checking and counter-messaging is really important because you can't let misinformation just go unchecked. But that can quickly become kind of a game of whack-a-mole, right? Like misinformation pops up here and you hammer it, and then a different thing comes, you hammer that. So I think, and I'm going to borrow an idea that Kathleen Hall-Jamieson at the Annenberg Public Policy Center advocates, and that is that we also need to be building actionable core health knowledge in people that applies much more broadly than one specific misinformation claim. Does that make sense? So one example that we've sort of been toying with in St. Louis, because there was a recent story about hair straightening products being associated with some gynecological cancers. And so what's the core piece of knowledge that might address that and other things? Well, it might be something like skin is permeable, right? Like stuff that you are exposed to is going to get into your body in some dose, and the consequences of that may be adverse for your health. Does that make sense? So I think trying to move away from simply, or move away from only responding to specific claims towards trying to build a knowledgeable public that when they hear things, much like inoculation, can sort of hold it up against some of these core truths and say, well, that maybe doesn't sound exactly right.
That's a great point. So using our capabilities and abilities to educate the population or educate the public around different issues, and then once the misinformation starts to spread, they have a filter to kind of review that information in, right? So, and that's our role as health communicators, to make sure that folks understand the truth and what's really out there and around health. I think a lot of conversation today, especially in this meeting, has been around social media and digital platforms and how they play a significant role in information dissemination. But they are also a hotbed for rapid spread of misinformation. We're now up against, as we heard this morning, artificial intelligence, and I'm 50% optimistic and 50% scared as hell. So that's where I am right now with AI. There's a proliferation of unchecked user-generated content out there. There's echo chambers that are getting created by social media algorithms, and there's so much more out there. But what can we as health communicators do to begin to combat that rapid spread of health-related information online specifically? And I think we touched upon a little bit of it here, but is there anything else that us as health communicators need to just keep in mind and keep just moving forward to tackle this health misinformation?
One thing that I thought of, in one of the earlier panels, there was talk on social media influencers and getting them to be part of the way of spreading accurate health information. I think another tool for them is helping them be a stopgate for misinformation. If you can give digital media literacy training to major influencers who have big platforms and just prevent them from sharing that one post with misinformation, that can severely slow the spread of misinformation if they can just be kind of a stopping post where they're not sending it out to their millions of followers. And so that's one little thing that I think can be useful, is that it's great for everyone to have some digital media literacy training and understand the hallmarks of misinformation and not spread it, but it's particularly important for those with big platforms that they're not accidentally spreading misinformation to their followers.
I think that I'll speak a little bit as to what we did, and hope that's helpful. So right when the pandemic started and we realized that a lot of communities were being hit harder than others, the first thing we did is we wanted to listen. So we wanted to understand, what are people hearing, where are they hearing it, who are they hearing it from, what channels can we strengthen, what channels should we maybe distract from. And we found a lot, like on social media, a lot was being said. In communities, a lot was being said. So we put on, I don't know, this is my, like, in my head, it was like a full force counterattack on this. So we did everything. On one hand, it was called COVID Talks. So once a week, we would have an Instagram Live. And it was really cool. Something unique about the pandemic is people wanted to help. People saw that people were being negatively impacted by the COVID-19 pandemic. So they're like, what can we do to spread accurate health information and help our community? And so example is we worked with the WNBA. They reached out to us and they were like, what can we do to help educate people? So one of our COVID talks was with a WNBA player on Instagram. And what was unique about that is that when you do an Instagram Live with someone, it notifies your followers and that person's followers. So I don't know, I think like 500 followers at the time because we had just started that account. But Elizabeth Williams had a few thousand, and I think we got like 300 or something on that call. And so the COVID talks, we did it with influencers, and we tried to stick to influencers within the medical field, just because we wanted to make sure accurate health information was being shared. And if we weren't, so for example, with the Elizabeth Williams one, we were very careful to say what we would discuss, just because we didn't want to further any misinformation, even if just by accident. Something else that we did is we had different panel events. And so we had one with Dr. Kizzmekia-Corbett, who was a part of creating the Moderna vaccine, which was really awesome. And because she had a lot of media attention, that panel event also had a lot of media attention. So Sophia Bush, for example, I don't know if anyone knows who she is. She was on a show called One Tree Hill. She reposted on her story we were having this panel. And I follow her just because I like her. And I saw that, I was like, oh my gosh, my face is on Sophia Bush's Instagram page right now. That's so cool. And it wasn't anything we did intentionally, but we realized that when you're genuine in your desire to help the community and you partner with the right people, other people will also want to partner with you. So in thinking about influencers, a lot of times there are some who unfortunately just won't be interested in sharing health information. That's not their brand, that's not the things they want to share. But there are others who are genuinely interested in helping their community, and so it does have to be a partnership in figuring out how they can be impactful with their following and also how they can help you be impactful with what you want to do. And so that was on the social media side. On the other side, it was really important to us to work with our community. And so one of the focus group participants we had, and I know we talked about this earlier in sustaining partnerships, I remember him being like, yeah, all of a sudden all these health organizations are coming into my community and they're expecting me to listen to them, but they were never here before, so why should I listen to them, or why should I believe that they actually care? And in misinformation and what both of you were sharing and getting ahead of it, that's such an important piece in having these long-lasting, trusted partnerships with community members, where people know, oh, I heard this, I know this person at the health department. Be right back, let me go confirm that with them. Or like, for example, with the Department of Health in Osceola County, we created a know before you go spreadsheet of things that you needed to know before you went to get vaccinated. And people in the community knew about it. And so we found out that when misinformation spread, they're like, oh wait, let me check my know before you go thing. And they're like, no, it says this, so actually you're wrong, you know? And so that was the most effective thing for us, was partnering with trusted community partners. We ended up going to a lot of food drives over the course of the pandemic. And so people just trusted us because we were there every week. We showed up. And the last thing I'll say is something that was also unique about this experience is I grew up in Central Florida. And so that was our catchment area. It's where we were working. So we did focus groups, but also talked to my faith community. I also talked to my grandma. My grandma didn't get vaccinated until, I think, 6 months ago because her pastor said something and she didn't believe it, ended up being intubated, and then after that got vaccinated. So I'm very near and close to the misinformation, and that's my biggest challenge for health communicators moving forward. Is theory is important, the planning, all of that's important, but really the partnerships and the execution in ways that centers communities and upholds their values and what they need is should be the priority.
Just to underscore Jessica's point, I think every survey that's ever been asked about who do you trust for health information has as the number one response, my doctor, and then a big gap, and then everything else. And so ask yourself, is it realistic to think, for example, that every primary care provider would be out doing their own, misinformation research day after day, so that this, of course not realistic. So I think we should think of this as, how can we put timely, accurate information in the hands of people who are trusted, not just medical providers and healthcare providers, but also others who have wide reach and trust within communities.
And Matt, your I Heard project is really innovative and different, and I think it's actually going to be a game changer. Could you speak a little bit about that, the trusted messenger approach, but then also specifically, how are you able to measure success with this approach, with the program? Could you talk a little bit about that?
Sure. And I would say the trusted local messenger piece of I Heard is probably the least developed so far, but the idea is this, that we shouldn't be reinventing the wheel. We don't have the luxury of time or resources to do that. And when there are people in the community who are known and trusted and have audiences, that we should be doing everything we can to make it very easy and very fast for them to share things through the channels that are already established. So that's the idea. And so each week we're producing digital assets and making them available to those partners. They can easily customize them. I could care less whether it says I Heard or NIH or SEAL or Washington University. I don't care at all. You just need to have the information. So so that's sort of that's the idea. I think where we are right now, evaluation-wise, is still really documenting sort of the feasibility and the process of executing this in communities. And I think the answer to that has been, we can definitely do it. And we are at a point now where most of the evidence that we have, I would say, is sort of impact stories, kind of anecdotal examples, and I'd be delighted to share some of those with you. But we are definitely moving towards like a community impact evaluation where, what would you expect to see from a system like this? Well, I think you'd expect to see that community-wide individual community members were their belief in and their exposure to health misinformation declined over time. I think you'd also like to see that the community organization partners that are routinely every single week getting these new resources to respond to misinformation, that their capacity goes up, that their confidence goes up, and that they feel like they're better equipped to address misinformation when they encounter it. So I think those are some of the outcomes that we'd be looking for.
That's a great point to make. I never thought about that, of building the confidence of people to help mitigate the misinformation on the ground. So, yeah, because a lot of times we're confronted with misinformation, and sometimes you're like, oh, do I step into that water? But yeah, it's building those folks' confidence to do that. So that's a great point. Sure.
That reminded me of one thing that I wanted to make sure to mention is when we think about correcting misinformation, especially on social media, we often think about correcting the person who spread the misinformation, who originally posted the misinformation. But I really want to encourage people to think about the broader community who's also exposed to it. So when you post a correction to a post, you're not just trying to correct that person who originally said it, you're also trying to correct everyone else who's going to be exposed to that. And there's a lot of cases that you're not going to move the original poster. They already have very firm, entrenched beliefs, things like that. But what you can change is someone who didn't really know anything about it, saw this post, would have thought that, oh, that makes sense, maybe that's right, but instead sees your little message below, oh, actually, I think that's wrong, here's a link to the fact check about it. So thinking about correcting not just the original poster, but everyone else who will be exposed to that message as well, who might not have those same entrenched beliefs.
And I just want to shift here and look towards the future. And wanted to know, are there any innovative approaches, technologies, or partnerships that we should be thinking about or considering leveraging to combat misinformation? Jessica, you talked a lot about the local partnerships and the relationships that you built, but are there others that we should be thinking about and considering in our work?
I Heard is really incredible from the beginning. I've been such a huge fan. But I think that something really cool that we got to do is we worked with barbershops a lot. So we trained 2 cohorts of 13 barbers who ended up reaching, I believe it was over 1,200 clients. And they were just trained to have conversations with their clients about COVID-19. And they were trained to address misinformation when it was brought up by their clients, and then train their clients to go share that information with their community and correct misinformation in their community. And so I think that definitely training programs like that are very effective. Something that I've been incorporating into my research more is also the concept of human-centered design. So centering community voices in solutions, and I think that's something that will definitely be helpful for misinformation moving forward, is really understanding what the kind of what you were talking about, like what the root of the misinformation is and how can we say like the principal truth, so that when this random fact comes up, someone can be like, wait, I heard about this because it was made for me by my community, for my community, and I can say for a fact that's not true. So definitely think that it's important to look towards innovative, human-centered, community-based practices like crowdsourcing, things like that, that really are by the community for the community.
Relating to that, just another example of this kind of by the community for the community. There's an organization that was working in Filipino communities in the US, and they were trying to figure out how to best communicate about vaccine misinformation and how the vaccine works. And they ended up with this wonderful example that used a traditional Filipino food that for me means absolutely nothing, but for that community, very succinctly and accurately conveyed exactly the metaphor they were looking for, and was really effective for members of that community. So I think a lot of times we try and make our messages appeal to the widest audience possible, which is really useful for some campaigns, and then other times really thinking about what will be impactful for this particular group that I'm working with.
Add kind of a methodological opportunity for improvement. If you think about how we detect misinformation currently, it's really, there are kind of 2 buckets of approaches. By far the one that's most common is what I would consider to be environmental scanning. So we have people who are constantly monitoring the online information environment or other information environments, and they can flag as soon as possible misinformation claims. The other approach that's used, less frequently and is the surveying of specific people and asking what have you heard. So two observations here. One is we haven't yet figured out a really efficient way to marry those 2 sources into one sort of richer understanding, and we need to do that. So I think that's an opportunity. And then I think the second piece is most misinformation doesn't spread instantaneously. It can spread really fast, but you could interrupt that. We have to shorten the time frame between when we detect misinformation that's emerging and how quickly we're able to stop it, to almost stop it before it starts. So there's the ideal, I think, as Lisa said, would be to inoculate people against it to begin with. And if you can't do that, I think the second best thing would be as soon as even a hint of it is in the air, you squash it down before it can grow. And so those are 2 areas where I think we could improve.
Great. And before we open the floor for questions and comments, I wanted to ask each one of our panelists to provide the audience with just a few key takeaways. What further reading and or resources or tools do you want this room of health communicators to take away from this conversation that will help them learn more about misinformation or combat misinformation, or be the one to think of that new monitoring tool or system to improve the way that we're able to mitigate misinformation?
So I'm going to give 2. So the first is called the Debunking Handbook. If you Google it, it should pop up. It's a resource created a few years ago by a consensus group of about 20 psychologists who do research on debunking. And it just provides really practical tips about how to do it, when it's most useful to use debunking and some example strategies of how you can do it well. And I think, like I mentioned before, debunking isn't the only solution, but it's a good part of the solution and something that is worth doing. The other thing I'll recommend actually isn't out yet, but it'll be out soon. The CDC and American Psychological Association jointly sponsored a consensus document on the psychology of health misinformation, and that'll be coming out hopefully in the next few months. It tells you a lot about why people are susceptible to misinformation, how and why it spreads, and also what we can do to combat it, and ends with some recommendations for health communicators and others. So just keep an eye out. It should be coming out soon.
I think that my biggest takeaway will always be to go to the trusted messengers in your community and to really understand what your community is hearing, why they believe it, and how you can address it to maybe share accurate health information. And I know that, again, Brian Southwell wrote a really great article talking about how misinformation can mask gaps in public health response. And it was just talking about when you have trusted partnerships, it makes it so much easier to trust where your information is coming from. And a big takeaway that I'd give is that we should ask ourselves, why is it so easy for misinformation to spread? Because if people have access to trusted information, if they trust people giving them information, then would it not spread as quickly? And so thinking about developing these long-term relationships with community members where, one, we know what's being said in the community, kind of something really great like I heard, like we know what's happening, but also how do we stop it? What do people need to hear? How can we help spread that accurate information is definitely the most important thing. And by each community, it'll vary. For us, the barbershop method worked really well, and going to food drives worked really well. Versus for another community, it might be, I don't know, being at grocery stores, farmers market. So definitely figuring out what the community needs and what the best method is, and not necessarily what us as researchers might think is the most helpful.
My lesson learned is the same as Jessica's, which is you can't effectively respond to this without pretty significant local involvement. I mean, we think about this broadly as a public health challenge for the nation, and it is, but the response is going to have a heavy dose of people locally who are known and trusted.
And I think that's a theme that we've been hearing throughout this conference is relationship building and solidarity with the community and with the local communities, whether it be, tackling AI or tackling misinformation. Those two things are not going to go away in what we do in our role as health communicators. So I will stop this panel conversation here and open it up to our fourth panelist, which is you. So if you guys have any questions, please feel free to come up to the microphone. And for those that are online, feel free to put them in the chat.
I've been doing health communications for, 25 or more years. When I hear these conversations, I'm always struck by how certain people are about misinformation and what it is. And based on all my experience, including talking to a lot of people, Matt said the skin is impermeable, or permeable, I guess. So I Googled, is the skin permeable? And I got two different responses from legitimate sources. One saying it's not because they were trying to dampen your worries about risks to environmental factors and chemicals. And the other one saying it was because they're developing medicines and vaccines that can be put in your arm, and they need it to be permeable. And so, and COVID vaccines are ineffective, or flu vaccines are ineffective. How do you know that's misinformation? It depends. You don't know the context, right? I mean, so if the context was that the vaccine, the COVID vaccine, is ineffective because it's not going to eradicate the virus, it's absolutely right. It's not misinformation. If the context is the vaccine doesn't work, it's wrong because it does prevent severe illness. And so I just think that we need a higher level of sophistication when we're talking about misinformation, and some humility, because a lot of what comes out to be misinformation is we changed. We, the experts, said one thing one day, and then we got more information and said something else the other day. And we also don't we often assume that the audiences we're talking to have as much knowledge about these medical topics as we as experts do, and they don't. Nor should we expect that they would, right? And so I think a lot of the misinformation they have is, it's not misinformation, it's misunderstanding. They don't follow an issue as deeply as we assume that they do, and as a result, they make bad decisions. And I just think that needs to be somehow factored into these efforts to deal with misinformation.
Yeah, I mean, I'll respond to that a little bit. I think there's a wide variety of things that we can include under the umbrella of misinformation. A lot of it is things, yes, that are false now, that we thought were true earlier on. But a lot of it is also purposeful disinformation campaigns that are just blatantly false about things. And I think it's important to think about all the different things. So there are things that are actually factually true, but also incredibly misleading. So early on after the vaccines, a Florida newspaper ran the headline, physician dies 2 weeks after receiving COVID vaccine. That was a true headline. He did die 2 weeks after receiving the COVID vaccine. There's no evidence that the two were related, and the headline got picked up and spread like wildfire on social media and led to a lot of vaccine hesitancy. And so in my mind, that is a form of misinformation, but it's also not false. And so I think there's a wide variety of harmful content that varies in its truthfulness.
I think what I'm going to talk about is really very related. It's a little bit of the same thing. It's a wonderful ideal to increase the broad knowledge of general health information, but one of the difficulties with misinformation is truthiness. People take something that sounds right, and to a general audience, it's coherent with what they know, but it's wrong. It's wrong in the details, or somebody has taken, a general fact and subverted it, or I think that's where a whole lot of misinformation comes now, so it's just hard to do this. Do you want to speak to that?
In the scientific literature, this is known as sort of gist understanding. You sort of understand the gist of things, which sometimes works really well if your gist understanding is correct, but it can be, it can be the opposite as well. And so I think we as health communicators should understand that and try to use it to our advantage. Can we build accurate gist knowledge that's transferable widely to different health contexts? I think that's particularly important. I also wanted to respond, Glenn, to you had a lot of great stuff in that comment. I think one thing that we should acknowledge as we start to dissect what could have been better about the COVID response, I think you're right that we, as a public health community, didn't adequately acknowledge uncertainty when there was uncertainty. And I think we did that for reasons that probably felt well justified at the time, which is, oh my gosh, we're in the middle of a pandemic and we have a life-saving vaccine. What we want is people to get the vaccine. We don't want to talk about the breakthrough cases or things like that. And I think if we learn a lesson, well, among the lessons we should learn from that is that ultimately that's not a great strategy, that we should be really very clear with people. We should help people understand that knowledge changes, and in the pandemic it changed weekly. It was maddening. But we should do that, and we need to do a much better job of explaining that to people. The last thing I'll say here is that if you leave here with one word, I would want that word to be explanation. I think we've done a really poor job in general explaining things that are very clear to us as health professionals to the public who don't understand them at all. And if we can all do a much better job of explaining even the simplest little things that we take for granted, we're going to get further, because a lot of people just don't understand the basics, and that makes them more prone to inaccurate information.
Hi, my question is for Lisa. Hi. You just talked about how there is people who are intentionally spreading disinformation. We know that it can be socially and financially rewarding to do so. What is the role of the public health community, and really working with the platforms to ensure that information is at least explained or reduced on those platforms?
Yeah, it's tricky because, like you mentioned, private companies currently control a lot of our public square and a lot of how information gets spread and communicated. I think one thing public health communicators can do is put pressure on the platforms to document when there's blatantly false information around, especially times that they're not living up to their actual commitments. So times that they say, this is our policy on X, and you can come back and be like, well, you said this is your policy, but here are all of the examples of things that I just found that break that policy. That can be one way that they will respond to that, oftentimes in a way that they won't to other things.
Hey, so Lisa, I wanted to thank you for your comment about engaging and knowing that even if you're correcting misinformation to someone that you're not going to change their mind, it's very possible, but that other people who see it, especially on social media, will. I help manage some of the CDC social media channels, and we've, in the past year and a half, tried to do a much better job of engaging directly with questions, not always misinformation, but just like questions and everything. But because of the pandemic response, because of the distrust that has developed, sometimes they just don't want to listen to us, which is fine. Are there any, as we're talking about theory versus practical tips and things we can take back, are there any suggestions anyone has for when you're responding to something, just repeating the same information over and over again, it maybe isn't being receptive? Are there other ways to present that information in a Facebook comment that, like, you know, kind of helps hit those same points without just regurgitating the same information that was in the post that they commented on that they clearly either ignored or didn't read or don't care about or whatever? So.
Yeah, it's a tricky one. I think, so my colleagues Letitia Bode and Emily Vagra have done a lot of work on this. They call it observed correction. And they find a lot of they've tested out a bunch of different ways that you could respond. You respond with humor, you respond with a post to link to the CDC itself responds, other health organizations respond, different people respond. In general, it doesn't seem to matter that much. Like, the most important thing is just to get the correction out there. I think one of the things when you're in discussions on social media is just to remember that you don't have to be in that discussion. Like, if it's not going anywhere productive, you can peace out, and I feel like that's okay. Especially if you're trying to do this observed correction thing, like, that first post you made is really all that needs to be out there. Like, you don't have to keep responding if they're not having a good faith effort at understanding what you're saying.
I will say too, I think towards the middle of the pandemic, California came out with what was called the Human-Centered COVID-19 report. And I really liked it because it just talked about the different phases that people might be in the vaccine hesitancy. So you had like the reluctant ones where it's like could be convinced, but they felt reluctant about it. And then you had the ones that were like absolutely nothing you could tell them was going to change their mind. And so I think that there's a few important things in thinking about messaging. So one, empathy has been mentioned a lot today, but like leading with empathy of just like I believe the vaccines are what's most helpful, there's people that most believe they're what's least helpful, you know? And we completely disagree. We may not ever agree, but the reality is that's their opinion, and I can empathize with whatever it is that's leading them to that opinion. Can I empathize with their actions and maybe them spreading misinformation? I don't know. But at the root of the thing, we all want to do what's best, or most of us want to do what's best for ourselves and our community. I can't speak for everyone, unfortunately. So just knowing I think it's really important to know the root of different things. That way your communication can be geared towards that. So like, example, again, with the person who is scared of deportation. At a base level, she didn't want to get vaccinated. And if we hadn't have asked her questions, my messaging might have been why vaccination is beneficial. But at a deeper level, at the root level, she was scared of the consequences of if she was caught without documentation. So then our communication could be geared towards that. So my biggest advice for that is to not use one specific form of communication or the same message, but to vary your messaging, because different people have different roots for their reasons for accepting misinformation and spreading it as well.
I just want to do a really quick time check. So we have about 3 more minutes left in this panel. So hopefully we'll get to everyone's question.
One more question here, and then we're going to go online.
You want to do the online? Okay.
My question will take 8 seconds. My name is Andy Burness. You all have given us a lot of guidance, and even while I've been standing here, I'm taking notes in my head. Can you go from the abstraction of the notion of uncertainty, the notion of targeting messaging? Can you give us 2 or 3 examples of very specific instances where misinformation was a problem, it was seemingly intractable, what you weren't going to be able to succeed, in victory, something was done in the health space to turn that around and it wasn't a problem anymore, as in a solution, a specific thing, not an abstraction? So the answer may be no, but I leave you with that. So thank you.
I can go ahead. I do have 2. One, maybe not the answer you want, and then another that probably is. So one, we had a lot of community members, again, refusing to get vaccinated. They were saying a big thing was the clinical trials were too rushed. The clinical trials were too fast. I don't believe it. So what did we do? We had a panel with Dr. Kuzmekia-Corbett. Another big thing, I'm a person of color. I don't trust the vaccines that are made by white people for white people. So what did we do? We had a panel with Kuzmekia-Corbett, incredible scientist, background in sociology, incredible black woman who was able to say, no, like I was a part of this, and I recognize harms against people of color in the past, but like this was specifically done so that we could reduce the disproportionate burden of COVID-19. Follow-up surveys, a lot of people said we weren't going to get vaccinated, but now we are because we heard this. We also opened the door for questions so people could candidly ask questions. I remember we got one being like, how do I know this isn't like another Tuskegee? How do I know this isn't like another Henrietta Lacks situation? And we were able to be like, yeah, that was wrong, and public health has been wrong in the past, but there are people here who are intentionally trying to help our communities. So that's one example. Other example, like I mentioned, grandma didn't want to get vaccinated. I'm sorry, SEAL people. I held a whole panel in Spanish, and it was good for the community, and I did it because I wanted to tell my community, but I was like, this is what I need to do for my grandma to get vaccinated because she'll support her granddaughter. It's in Spanish. She'll come to this panel event, and then it'll work. She heard that the COVID-19 vaccines weren't sped up, that they were intentionally worked on, and that they'll be evaluated in the next 10 years for any potential side effects they might have, but they're completely safe. My grandma heard, oh, I'll get vaccinated after evaluation things have come out in the next 5 years. Exactly. So sometimes people will hear what they want to hear. Grandma unfortunately ended up getting COVID, got intubated, almost passed away, and then that's what it took for her to get vaccinated. So unfortunately, there are moments where we can do everything. We can pour our whole hearts out onto this messaging, and unfortunately, it won't work. But we can do our job of meeting the community and understanding their fears and doing the best we can to meet them in that.
Thank you, Jessica. Mike?
Right. One last question from online. Someone's asking if you have any tips for finding those trusted kind of community folks. And I would offer the friendly amendment of also how do you convince maybe your bosses or more conservative public health agencies that they can use those folks who have existing audiences, but it means relinquishing a little bit of control over some of the messaging, because that can be a really hard leap, I think, for a lot of people to take.
Everyone's looking at me, so I guess I have to answer that. We actually had a process where in St. Louis where we went through. We started with organizational partners and particularly the leaders there, and we went through all of their social media accounts, and we looked for the size of their following and how active they were. And we created sort of a ranking, if you will, and we could determine on the basis of that those that we thought would be the most beneficial to community reach and spread. And so that's sort of how we started. As sort of an alliance of community academic partners, we're probably not as subject to the concerns that this questioner had about, aligning with somebody who might say something, colorful in a non-COVID context. So, and knock on wood, we haven't had that happen, but it's probably happening as I speak. So hopefully that provides an answer.
Well, our time is up, but I want to thank everyone today on this panel for giving some great insights, and I thank everyone else in the audience for giving some great questions and adding to the discussion. So we will exceed our time and give it over to the other panel. Thank you.